This is the third video in our series, and really to have you understand how I use silicone clinically. It is a permanent filler. In other words, there are going to be things you're going to age, there are going to be changes in your face. There is going to be something that we need to understand. How does silicone work as a permanent filler? There's something I like to call, which is called the Restylane roller coaster or injection burnout. What does that mean? In certain areas like the lips, that there's constant just dissolving the product within 2 months. It's very tiring to get injected. Fortunately, the areas that I inject Restylane or Perlane are in areas that are more long-lasting, that give you a little bit more durability than just in the lips. So I'm not a big fan of Restylane and Juvederm in the lips, except for people that are very young, that I'm not too certain about the long-term aging effects of silicone. But you know, if you're 25, 35 and there's, you know, not a teenager and you have it and you've already matured enough to really understand what you're really wanting for the long term, then a subtle lip enhancement with some silicone can work extremely well. Now, what are the two permanent fillers I use and why? I use fat and I use silicone. How do I use them? Are they the same thing? Are there limitations of one versus the other? Are they used interchangeably? The answer really is not the case. And in my forum on my website, I answer questions all the time, and I really realize the ignorance of people that out there that really don't understand this, and even surgeons that use fat in ways that I don't. So let's break down two permanent fillers, silicone and fat. How do I use each one and why? Now, before I get to that, I also want to have you understand that there are some products that are permanent that I don't believe in. I'm not going to mention any names, but there are a lot of products that are permanent that have really been on the market a short time. How long has fat been on the market? Well, obviously it's in your own body and it's there forever, but the first fat transfer was done in 1898, and the first real modern fat transfer done in a microdroplet technique that has shown longevity, late 70s, early 80s. So a long time in my opinion. In addition to that, silicone has been around for cosmetic injectable use since the 1960s. In my opinion, something has been around for 40, 50 years, almost 50 years for both, is much safer than something that's been on the market for less than 10 years that may have gone through multiple reincarnations or permutations because of some of the issues that it hasn't been as pure as possible. So I like to use these products. Now let's break it down. How do I use each one effectively? Fat grafting I really use for overall large contours to blend and soften an aging face where there is bone exposure, concavities, and really for larger areas to blend in. When I work with silicone, it's for small areas. It's for a little nasal defect when someone has already had a rhinoplasty that maybe not have turned out as well as possible. I even use it in my rhinoplasties if there's a little area that I need to just make perfect. Acne scars, little tiny areas that work really well like that. Lips are beautiful because it's so much, in my opinion, softer, permanent. You have to deal with it compared to Restylane or other products. And again, I love Restylane for facial enhancement until you can do something permanent like fat transfer. It's great for folds and lines. So there's a mnemonic that I use that fat is not good for lips and lines. And guess what? That's where all the other surgeons use it. I think it has a high failure rate because the lips, big time swelling, doesn't look natural, high resorption rate. In the folds, I like to use, fat just doesn't have enough the oomph, you know, this, I don't know if it's a technical word, but it doesn't have enough oomph to really fill those folds and create a nice change there, at least not what you're looking for. So silicone, in my opinion, works much better for small little areas. I've had some questions in my forum where someone asked me, well, would you do fat in, you know, a little area divot here and there? And the answer really is no, and the reason is that fat is a live graft. It has to have blood supply, and it does change a little bit of weight. It does change with a little bit of aging, and that's why you've got to use fat more symmetrically, because if you put a little area here and you gain weight, lose weight, you change as the blood supply starts to kick in, it can actually fluctuate, and that's not safe. Whereas silicone is bioinert, meaning that it will actually not fluctuate or change with weight or change other types of fluctuations. So if you have a little scar, a little this, I find silicone a much safer technique to work with those small areas, and it's much more effective in lips and lines. Fat is much better for overall contours. Long-term effects, the nice thing with silicone is actually there's a little bit of gradual build just from the scar tissue of the needle injection, and that to me is actually oftentimes a favorable attribute. With fat grafting, there's long-term changes that can occur in the texture, tone of the skin, and it's not clear, but its idea is stem cell changes. And those stem cell changes can actually create a little bit better softening of the skin. Those are some interesting long-term ideas with both silicone and fat that you may not have thought about. So that's really how I use each of those permanent fillers. Those are the only two permanent fillers that I feel comfortable using, and I feel comfortable because of the purity of both products and the long-term time it's been on the marketplace compared to a lot of permanent fillers that, in my opinion, have been much shorter time on the market, that have gone through too many permutations. And if you don't believe me, just ask the company before you buy into a new product. So hopefully that is a good summary. I'm not here to sell you silicone. If you feel that it's uncomfortably unsafe for you for whatever reason, don't do it. Very simple. I'm not here to sell you anything. I'm here to truly educate you on the pluses and minuses of each of the products I've mentioned.